this is Megan Daniel. I am the administrator for community partnerships at the Partnership to Reduce Cancer in Rhode Island. I'm joined today by Joe Jobeck, Executive Consultant Director of the partnership, and our guest, Warren Miller. As our organization is growing, we wanted to provide our audience with the opportunity to get to know the members of our board, as they are the key decision makers in our work. So we are joined today by Warren to learn more about his involvement with the partnership, his experience as a social worker, and any adjustments he has made in response to the COVID-19 pandemic. So to start, Warren, if you can tell us a little bit about yourself and what you do.
Yeah, thank you for having me today and having me here. I really appreciate it, and I love the idea of being able to profile the board members here, right? As Megan shared, my name is Warren. I'm Warren Miller. I am originally from Houston, Texas, but now, of course, living in Rhode Island. I currently practice as a private practitioner of social work, which is a practice that's fully 100% online. But my full-time job is as an assistant professor at Rhode Island College School of Social Work. And I've been in Rhode Island now for 2 years. I've worked as a professor, a full-time professor for the past 2 years, but taught part-time adjunct for about the last 4 years, with a private practice for the past 7 years that's been primarily online. And so, yeah, that's me in a nutshell.
Great. So we wanted to talk a little bit about your position as a board member with the partnership. So if you want to explain your involvement in your role on the board and how it may tie into the other areas of your life, professional or personal.
Yeah, so, I always think of my connection to a lot of things in life tend to be, I think, divinely connected, or kind of like they find me, I don't find it a lot of times, just like how I fell into social work. Like it found me, I didn't find it in a way. But I feel like my connection and my introduction to the partnership was the same way. I was recruited by my dean, who I know Joe was in contact with. And she was just like, "Oh, Warren, I think you might be interested in a board member position, in addition to being a part of something, but in addition to being able to make a hefty portfolio for my tenure and promotion package." So I was like, "Sure, let's talk about it." And so when I met with Joe and I learned more about the partnership, I was like, "Man, I really need to be a part of this." I mean, although working in healthcare for as I did prior was important, and although I've come around and interfaced with people living with cancer, and my dad passed away from cancer, I never thought I would have a more active role. So when this opportunity showed itself, I was like, I got to jump on board. So right now, I have now been a member for almost a year now, and I am the treasurer. And so, which is also interesting because of a previous organization I was in, my alumni association, I was this treasurer there for 3 years. And so when they needed some folks to step up, I was like, hey, I got a little of that under my belt, so why not? But the work that, the partnership has, what I've seen and what I've learned and have done has really enriched my life professionally and personally, but professionally in a way of has me thinking around, okay, so how can we incorporate social work in treatment of cancer around what does that look like for medical social workers with treating patients who are living with cancer? What does that look like for training social workers and social work students around medical issues with patients or people who are surviving and living with cancer? So it's been a nice touch to work with the partnership in this last year. So I look forward to learning more and meeting more. I know COVID-19 has kind of slowed a lot of this stuff down, but I think it's, in a way, it's good because now we're able to kind of plan and do a lot more in terms of what's to come in later this year or even in 2021. So I hope I answered the question.
Yeah, thank you for sharing. I guess I'll use that as a segue in terms of COVID-19. That has changed a lot this year in terms of our work and teaching and learning. So you are a professor and you are in social work. So if you would like to speak a little bit to that, how your work has changed, a transition to online learning and practicing, and kind of how those decisions were made in your work.
Yeah, so COVID happened, well, COVID happened way before March, but we went on spring break at Rick and we came back and it was like, nope, no more in person, no more in class. And while that's devastating, it was devastating to students and surely to the faculty as well. For me, not a huge challenge, right? Because I come from a world of technology use, remote online instruction, online learning, and practicing. So I providing therapeutic services via HIPAA compliant softwares like Zoom and other programs and software. So I was like, okay, yay, this is cool. This is okay. But now how do I help orient and create a space for students to actively be engaged in this format when it wasn't a format that was thought of being used in this environment at this time? So it was it's been a lot of growing pains with, orienting students, working with other faculty at Rick to, kind of create this space of adjusting to online and remote instruction and learning. I love it, because as I tell my students all the time, I'm a consumer of technology. We all are consumers of technology. So what's not to learn around harnessing the power of technology for social good? If that's in learning, if that's in teaching, if that's in providing social work services. And that's actually one of the big kind of big tenets right now of social work, or one of these grand challenges that the profession has kind of created is 12 big grand challenges, and one of them is harnessing technology for social good. And so I try to help, students and, my colleagues reframe their experience or perspective around, being forced, or not forced, but kind of, having to migrate into this type of experience. I'm just like, wait, let's take a moment to kind of appreciate COVID-19 in this moment around really expanding our learning experience and how we instruct and connect and still create a humanistic experience in this medium. So it's been actually really great for me in terms of, I do miss being in the classroom, don't get me wrong. I miss being able to walk down the halls and see my colleagues and, stick my head in the office and say, hey, how's it going? Can we go to happy hour? Or things of whatever. I do miss that. And I do miss some other things of connecting with family and friends. But in terms of work, I am enjoying this ride with helping build this in our program. And for my practice has always been online. So all of my clients were already oriented to, it was like, we've never missed a beat when COVID happened. Nothing changed. While I had colleagues who were still having practice and were struggling because people didn't want to do it, their conversations were a lot different with their clients. My conversations were still on what was happening the previous week. So it hasn't changed much, but it has changed a little bit in my teaching work, which it's been really great. And I do research around technology, the use of technology in social work, particularly student adoption, student adoption of technology and programs, social work programs adoption of technology. And so this has been it's been a really vibrant time for me. So I haven't been, too crazy about it.
Yeah, it seems like you had a leg up, especially in terms of your social work, since that was already all online. Um, so I guess more in terms of your teaching, were there any challenges that you or your students did face with the online communication?
Yeah. So unfortunately, there are some students who, so one thing to kind of be prepared to teach online or in a hybrid or remote environment, and it's another entirely other thing to kind of just be thrown in and saying, hey, this is what you have to do now, right? Because there's no preparation. And so at the beginning, and we were in the middle of the semester when we started, so in middle of March, we had to kind of reconfigure around how we're going to engage and still kind of connect with students, because while in my brain, I think, oh, folks have access, well, not all the time, but, I would think a student might have access to a computer, a reliable internet connection, a reliable device that allows them to connect. However, not understanding or not fully understanding that some of the students only have this because they come on campus. Some students only have to connect to Wi-Fi or internet or have these appropriate devices or technologies because they are able to come on campus. So how do we troubleshoot and access and connect with the student who can only connect via phone? But if you're holding class synchronously, like we're on this meeting today, right? Live Zoom or live on Blackboard, which is our learning management system. How do we access that student or those students who are getting by the phone? So we did a lot of troubleshooting early on, from having low barrier technology where we were allowing students to join in by phone, they can dial in on a number, to any high barrier, high tech learning to where it was face-to-face, synchronous work, and doing online work. But being able to trying to accommodate every student across that cascade of experience and need level was tough initially. I think now for the summer, we've kind of gotten better. There have been some resources pushed out around the state and from the school to be able to provide students with certain help around getting technology and devices. And so while it's a little better, it's something we have to still kind of consider, because it's something that could be, kind of like the rug pulled at any moment, and still having to go back to understand how do we include these different levels of people with access, students with access to it. So that was a very tough experience at first, to where I had an experience with students who were just like, I can't finish this semester. And I'm like, no, we're going to get you through this semester, because there's no way you're going to make it to half of March and we only have a month and a half left of school, and you're just going to be like, I can't do it. No, we're going to get you through this. But we have to be very innovative on how we do it and make it appropriate. So that was tough. And then summer happened, and so we kind of got a little bit more resources. And so now it's going on an even flow of things. An even flow around adjusting and working with students. And I think initially we had a lot of students who said that, oh, if this is the way it's going to be in the fall, absolutely going to take a year off or take a semester off until we can be fully integrated back on campus. And now I'm noticing students are saying, okay, I think I can get with this, depending on the instructor, depending on what the requirements are, if they're willing. And certainly the institution is encouraging all faculty and staff to really assess what their courses or what the needs are to provide those different levels of technology. So from low threshold to high threshold technology, how do you create an experience for each student And so that's what they've been focusing on for the last couple of months, actually, to get us prepared for the fall, which we're still working out to see if we're going to be online or some hybrid or face-to-face, but I'm thinking that it's probably going to be a mixture of all three depending on the program. So
Great, thank you. I'm going to transition a little bit. We know that you've been in Maryland doing some work with COVID-19. Could you explain that a little bit?
Yeah, so Maryland, a couple of months ago, the Baltimore, Maryland, University of Maryland medical system put out a notice for requesting healthcare professionals to come and work with COVID patients in Baltimore because it was the intake and the uptake in cases were rising, and so they are using the Baltimore Convention Center and a number of other hotspots there to be able to treat stable COVID patients. So they were kind of putting this call out to like the East Coast area healthcare professionals to respond to this. And so I responded to it because I was teaching online, and I was like, oh, well, this is also an opportunity to kind of go back to Maryland because I used to live in DC, Maryland, Virginia area for 11 years. And I was like, it would be great to be back in that area while I still can work and teach for Rick. So I answered the call to be able to come and train social workers on how to interact with patients, patient populations in medical facilities, medical social work, psychiatric, behavioral health social work. So I was tasked with training those social workers who were going to be working with the COVID patients. I thought I was going to be able to get my hands on a COVID patient, but the training happened before, and then it was 2 weeks after when they started allowing the first COVID patient to come into the Baltimore Convention Center, which is where they started having the stable patients. And I was already gone after that. So I came and trained the social workers who were going to be working with them. And so I'm still getting their emails. So I think it has hit the ground and it's running. I guess I'm fortunate, but I was kind of bummed that I didn't get to actually work in the facility. But I did get to work with the social workers who are going to be working with those patients, which is, right up my alley around training in social work. So medical and behavioral health social work is where I am. And so it felt good to kind of just be in that moment in training and kind of in a space that was still practicing, right? Physical distancing 6 feet. So imagine going to a in-person training where everyone has to be spaced out and you have your mask on, everyone had to have their mask on, and it was constant hand washing and what's the stuff? Hand sanitizing. And so it was interesting, but again, I was in my bliss because I love training. So it was a good experience. So I wish them well, and I haven't thought to reach out to say like, oh, you guys need some help, because now I'm like teaching a lot during the summer. So I was like, yeah, no.
Well, thank you for that work. That's really amazing. What you've done.
I can ask a follow-up question, Megan.
Yeah, absolutely.
In the cancer world, Warren, folks who are cancer survivors, and I know you're well aware my wife is one, there's a particularly acute anxiety around getting infected by COVID-19 and then the subsequent consequences to that. And I know as social workers, you deal with anxieties and how to help people cope with anxieties. Anything that came up in the training that you could pass along to someone who is watching this video, who's a survivor, who might say, is my fear irrational, or how do I, you know, make this anxiety less pronounced in my life?
Yeah. Sorry, that was my email. I just clicked out of it because it made a noise. Yeah, so a lot of times, thank you for asking that question. It is a time right now where people are living with fears, and some, some realistic, some potentially irrational, and that like heightens our experience with anxiety. And so so in training those social workers with trying to manage the expectations of patients, living with and experiencing COVID. A lot of times we worked around helping, encouraging folks to kind of understand if it actually is an irrational or a rational thing to consider. So saying that by saying, oh, is my fear realistic here? So what are the facts? What are the facts here? So what do I have going on with me? What do I need to understand about coronavirus or COVID? And then what information can I get from my doctor to keep me grounded, right? In that experience to reduce anxiety. The anxieties, and I like to reframe it because I don't think of anxiety as bad. A lot of times I actually think of anxiety to be life-saving, because I mean there's some type of triggered worry in us that cause us to be a little bit more maybe like focused or even hyper aroused, which doesn't mean bad. It just means, well, let me tend to this to understand. And so in an attempt to stay grounded in the facts of what's going on with COVID and what's happening with self, I would encourage people to do that. So when you do that by connecting with your PCPs, your medical personnel, right, to get the updated facts. We don't. I encourage people to tell people to stop Googling and self-diagnosing from what they're reading on, Dr. Google. And kind of like those normal things that we kind of forget to do, and when we're worried or when we're anxious, right? Deep breathing, relaxing breaths, being able to kind of stay present, and mindful, stacking the evidence against those negative thoughts that are coming around that's creating anxiety, of saying, hey, if everything is going to be negative, what are the evidence to support those negative thoughts around my experience with, living with cancer, surviving cancer, and potentially contracting COVID? What negative thoughts am I having? Are they rational? Are they irrational? After we stack the evidence against that and find out if that's a rational or irrational fear, then we can make a game plan on what that looks like in terms of, okay, stay grounded, being mindful, gathering the facts, and then making a plan to handle, what I have found to be rational in my experience. So if someone living with cancer is potentially could be potentially exposed to COVID or has been exposed, then there are, certain steps to follow, right, to be able to reduce some of that anxiety plan. Now, if the fear is just, which is probably happening for a lot of people, just really heightened because anybody with any other illness or comorbidities, are at higher risk for acquiring COVID. And so it's really, in general, I would say it's about really staying present, staying mindful, and as grounded as possible. And you do those things by allowing yourself to feel the anxieties, to think about those, have those thoughts, but gently moving them out of your mind. I like to say this, allowing your thoughts to get on the train, but you not with it. So kind of visualizing, you know, those negative thoughts or those irrational fears, kind of getting on the train and you're letting it go by, but allowing it to happen and you're not going with them. And yeah, in that way, you kind of being kind to yourself, but also really saying, okay, now I can think about what do I need to do to keep myself safe and still remain vigilant, but healthy around, you know, my thoughts around COVID.
Again, if you don't mind, I'd like to ask one other follow-up question.
Sure, go ahead.
You know, I think because of the coronavirus, Warren, there is greater attention being paid to kind of the social work side effects of the illness. You know, everybody, first of all, the concern is if you've been infected, getting properly treated medically. But then there's all the lingering social issues that come with that. You know, the isolation some people are experiencing in nursing homes, particularly because of visitation policies and stuff that are in there for obviously, you know, a good reason. Do you think that there is some lasting impact on the social work practice as a result of this, and maybe a greater appreciation for the role that social workers play in the overall health or recovery of the person who's contracted COVID-19?
Yeah, I think, yes. So short answer, yes. I think COVID has changed the game for a lot of healthcare providers, right? And more importantly for social workers, because it has created kind of a re-energizing of what it means to be social. I mean, what it means to acquire illness and how we work with those individuals, right? So, and I'm saying that it's across the board. So in how we do that with agencies and private providers who are working with individuals who are in isolation due to contracting COVID, and what does that look like if I still must face-to-face as a social worker still go into the space with someone who has contracted, acquired COVID, or what does that look like if I'm sitting on Zoom with that person? So I think that it has changed the DNA of social work. COVID-19 has definitely changed the DNA of social work. We can use COVID here, but any future, any future illness that kind of traumatizes and devastates us like COVID did, it's now we have this ability to be like, well, these were some things that worked and didn't work, or things that worked well during COVID. So yes, I think it has really maximized, changed the DNA of social work, but also kind of put this hyper focus on social service and helping professionals in how we connect, because the big thing, like you mentioned, Joe, has been isolation for individuals, specifically individuals in nursing homes, specifically other individuals who are, quarantining in their homes with no access to family and friends. And so I think one thing social workers and other health professionals have done very well is being how to coordinate with those people if they have access to them. And I know in Rhode Island, Governor Raimondo, they were working on programs through the Department of Health, are being able to connect people, social workers, social work students, nursing students, not sure if counseling and psychology students were included, but they were connecting students with people who had been diagnosed positive tests, who were recommended to quarantine, but who were in isolation, right? So they were connecting these people to get socialization weekly or a couple of times a week to be able to help with that, because with isolation, with no access to people. And and I've considered myself to be like, I haven't tested positive for COVID. I haven't had any symptoms. I consider myself to be a pretty healthy person physically and emotionally and mentally. But in just the past, I don't know how long we've been quarantining, but in the past 4 or 5 months, I can see how being by yourself or not having access to people or being able to leave your house, can be devastating and really play that much of a major issue in like your health. And so one thing that I loved about hearing through Rhode Island and really connecting students to that program was that they were going to be providing socialization to individuals who were an aging population who had to quarantine and self-quarantine because of their risk, right? Because of their multiple medical issues. And so it certainly has, I think, put a shine or a light or kind of not maximizing, but magnifying glass on what does socialization mean and how that continues to work in tandem with the actual physical medical care that people get. And, COVID aside, even like individuals who haven't, tested positive, but remain in those vulnerable categories of vulnerable populations, it has really, I think, put the gears in motion for social workers to, or other helping professionals too, because I'm seeing it in the literature almost daily. I'm seeing things come out around people writing on best practices around COVID and in treating isolation and socialization for different particular patient populations, right? Because it's important. And for things to be pushed out in journal articles so soon tells me that like this is something really serious and that the profession and professions are really focusing in on. So yeah, I think this has changed the DNA of social work and how we practice and how we connect and kind of put a spotlight on what socialization is, how do we intervene with with isolation due to medical issues, and how do we do that effectively is what I'm noticing. And, Rhode Island was one of the first places that I heard that were instituting these type of programs to help with the isolation in nursing homes, in elder care homes, in people aging in their personal homes, with getting phone calls from people to kind of check in and follow up to see if they're okay, if they need groceries, things like this that kind of created this safety net of socialization to keep people going and healthy as much as possible.
Great.
Kudos to Rhode Island.
Yeah.
I mean, there could be other programs elsewhere, but Rhode Island was like the first one I heard of. So it's like, kudos. So yeah.
One last question I have then that I just thought of while you were speaking is, how do you see you changing your work going forward in terms of your teaching, with social work, and your involvement with the partnership, due to COVID-19 and the adaptations you've already had to make? How do you see your work changing going forward?
Yeah, so I gather that I'll be doing a lot more teaching online in the fall than in the spring, because now word is out that Warren likes to teach online. And so now they're like, we should probably keep some section of courses online. And if you don't mind teaching them, we would appreciate it. So I was like, sure, why not? But so I'm looking forward to learning more about technology and how do we integrate that into the social work curriculum, and how do I translate a face-to-face class to an online class to make it dynamic enough where students feel like they're getting the same level of training and education, if not better. So I'm looking forward to going in that pedagogical route of learning for faculty and curriculum development in my program. I think for my practice, it would stay the same because it's always been that way. But one thing that I'm looking forward to with like working with the partnership is so like the summit. I know I wasn't part of the planning committee for the summit, but now, you know, considering that there are talks to, you know, have it at a later time, a later date, and I'm not sure if we've come down to what format that would be in yet. Am I missing
Not
that?
yet.
Not
No.
yet? Okay, okay. But being able to lend my experience and be a part of the next process of for the summit, because now knowing that it could be face to face or it could be virtual, things like that, but being able to, you know, kind of focus a little bit more on thematic issues that kind of came about in COVID, which has been like the social isolation for people, in particular individuals who, you know, who are faced and living with cancer, and how, you know, social work providers or social workers can help interface with that particular population, you know, has kind of been training in my brain. And so yeah, no, I'm looking forward to like what the partnership has in the works and the plans with all the across the committees, but in particularly the planning, the summit, and the work that we were starting to do around LGBT population and connection with cancer.
Yeah,
So
absolutely.
We'd love to have you on that committee.
oh yeah, yes,
Megan's
absolutely.
gonna put you down immediately. Listen,
Yes, and now you have it recorded, so I'm there.
absolutely.
You're locked
Listen,
in.
the school, as you know, Warren, I'm a graduate also of the School of Social Work. And one of the things that the school always prided itself on was being sort of an active agent of change in the community. And I think COVID has highlighted the health disparities that exist in cultural populations and in certain impoverished populations across the country, urban, rural. One of the things that the partnership wants to do in the coming year is to really focus on that as one of our major work groups. And we would love to partner with Rhode Island College. I know that I'm not putting you on the spot here. We're not going to put it down in recording, and you said, but if there's a way as we go forward, we can think about a collaboration with the School of Social Work and the partnership to further this issue, to try to address directly some of the health disparities that we see surfacing in the in our communities. We would love to do that.
Yeah, I think that's the beauty of the partnership, by having so many disciplines, individuals from, you know, from so many organizations being a part of the board and even the membership. That's totally, I think that's a great opportunity. I mean, we had our successful run with hosting the quarterly meeting at the Rhode Island College School of Social Work, which was fantastic. And I don't see why we couldn't, you know, work to develop a relationship and a connection around addressing those health disparities, and being more intentional about that in the work that we do. So yeah, I mean, we can certainly talk and figure it out, and, you know, contact the powers that be at the School of Social Work at RIC, and, you know, go from there.
Great. Now I'll switch it back to you, Megan.
All right. Well, I don't think I have any more questions. So if you're all set, Joe, do you have anything else you'd like to ask?
I would like to not ask, but I want to express our appreciation, Warren, for your contribution to the partnership in this past year. I think having the quarterly meeting at the School of Social Work was a great lift off, because the quarterly meetings had been somewhat suspended, I think, in the past year. And so it really revived it with some energy. And the one that followed up after that at the Hospital Association of Rhode Island was successful. But, you know, it's one more thing that gets added to your to-do list when you're on a committee or you're working on a board of directors. But it enriches our organization greatly. And so we appreciate it. We look forward to the coming year with you. I think it also points out, sometimes people think, well, if I'm going to be on the board of a cancer organization, and I was unaware actually that your dad had passed away. I'm sorry to hear that.
Oh, thank you.
But as a teacher in the online and all the other things, it's multidimensional. You know what I mean? It's not like you're coming to the board with one particular skill because you've been served as a treasurer before, so you be the treasurer, but you've got experience with online learning, which can be very pertinent to what we're doing with the summit. You work with the LGBT community, with other health disparities, and working with students, which is our next generation of social workers. So we really appreciate you being a part of the organization, and I'm glad that you offered or agreed to be our first board member to profile.
Yes, thank you. Again, I thank you all for, you know, allowing me to come into that space and, you know, be me, and kind of be a part of this process. So I look forward to the work that, you know, we're going to do, definitely over the next year. And if you're watching this video on our lovely website, please reach out to us. And they didn't prompt me to do this. If you're watching this video, please reach out to us if you have any interest in being a member, joining the board, knowing more. Please reach out to us. It's a really great organization that is doing phenomenal work in the community around reducing, you know, cancer in Rhode Island. And just, you know, flip through the website, read some of the notes from the board of from the director, you know. So yes, that's all I wanted to say.
Thank you, Warren.
Thank you so much.
You're welcome. Thank you.